We like to use the evidence as much as possible to really educate other healthcare providers, our patients, and the community at large so that they understand they're making a really good decision in choosing chiropractic for their healthcare. Sharing that information is so important. We know Kevin, and I guarantee you that every chiropractor listening to this podcast has seen this happen hundreds of times in their practice where a patient, because of just normal, healthcare behaviors of what they've been used to doing, or maybe even advertisements on TV, they go to their primary care physician and they've got back pain or neck pain or shoulder pain or knee pain. And the healthcare provider, their PCP, provides them with a guideline discordant recommendation. I had a friend of mine refer me one of his friends. He had gone to the chief of orthopedic surgery at a major university hospital that everybody on this podcast would know. That particular physician gave that patient who had low back pain and radiculopathy inappropriate recommendations for care, recommended benzodiazepines, muscle relaxers, and bed rest for this patient. And I literally almost lost my I was like, are you kidding me? I can't believe that the chief of orthopedic surgery is making this recommendation. And so, I really believe, it's our responsibility as healthcare providers to educate the community about the evidence that exists. Does the public know that the FDA came out with a warning, telling the public that NSAIDs increase your risk of heart attack and stroke within the first weeks of taking these medications? Do they know that benzodiazepine deaths have risen fourfold in the last 12 years? Obviously, everybody knows about the opioid crisis. So talking to the community about the evidence, as you said, I just posted on a couple of different